Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight where we talk about Lyme disease. As many of you know, these webinars are different every week because they're created by your questions. And the way that you get to create your questions is you get to write them to me, okay? So over here on this side of your screen, down at the bottom, is a chat box. Write your question to me there. The thing I ask about writing the questions, though, is please hit the enter key to send it to me only when your whole question is complete. So yes, write it as one big long run-on paragraph, okay? The problem is if you hit an enter key in the middle of your question, it sends it to me in multiple parts. It gets to be very difficult to follow on this side of the screen, okay? During the webinar tonight, I will post those questions for those of you that are here in the live version. And so you'll be able to see those on your screen. However, those people that are listening into recorded versions of this will not be able to see those questions. So I will read them out loud as well too, or a synopsis of the question. If the question is really, really long, I may not be able to answer it just because this forum doesn't work out for it. And also, when I try to post a long question, it actually locks my computer screen up, which doesn't work out well. So I see a lot of familiar names here tonight. I'm glad to see that many of you are coming back and you keep getting value out of this. I see new people here tonight too. And so for those of you that are here, welcome. I hope that you're able to get something out of this that's going to help you tonight. In terms of the webinar tonight, I'm creating a recording of it. You'll get an email from me tomorrow morning saying that the recording is done and that it's ready for you to view. If you happen to miss it, though, you could find it on my YouTube Lyme disease channel, which you can reach by, you can Google Marty Ross MD and you'll find my Lyme channel at YouTube, but also on treatlyme.net, my website. In the upper right-hand corner, there is a link to my YouTube channel. And also, you can find it on the homepage by scrolling all the way down to the bottom of treatlyme.net. You can also find it on my supplement store on the homepage down at the bottom. That's Marty Ross MD supplements, okay? And I post a version of it on my Facebook page as well, too. So if you happen not to get the email, don't worry. There's many ways that you can go ahead and find copies of this. Let's see, one other thing here. I think I have one other thing. Oh, yeah. Tonight's the last webinar that we're doing in this month. I will not be doing another one next week. I'm going to take a week off before we go back into another series of 3 in August. Okay. So in tomorrow's email, there'll be a sign up where you can sign up, a link that you can use to sign up for the next series of webinars that will begin in August then. Okay. All right. So with no further ado, let's go ahead and get started here. All right. Hello, SJ. Let's see. Are pimples on face something that is part of Lyme infection itself? Does Lyme create skin issues? What about dry cracks at the corners of the lips? And last question, have you tried using neem or OSHA in your practice? So to answer your last part, I haven't found neem or OSHA to be effective. I haven't used them a lot, but in the situations where I had people on them, I just was not that impressed by them. So to answer that part of your question, okay. In terms of skin and Lyme, one of the things that can lead to a lot of pimples in Lyme, there's 2 things I think of when people have a lot of pimples in Lyme. One is it's possible when you're taking herbal and prescription antibiotics to get too many yeast living in your intestines, okay? Now, believe it or not, that has something to do with pimples, okay? So what happens when you get too many yeast in your intestines, they release toxins. And certain people, and those toxins can get absorbed into the bloodstream and then go to your skin, all right? Now, there are some people with genetic predispositions that when they're exposed to yeast toxins in their bloodstream, they will develop pimples and acne, all right? So when I was treating somebody, for instance, with Lyme, or when I was practicing in Seattle, if somebody was under treatment and they developed a lot of pimples, I would start asking questions to help determine had they developed too many yeast in their intestines, okay? So things to consider would be pimples. And the other thing would be is if there's some kind of a decline, because if you get too many yeast in your intestines, it triggers your immune system to overproduce inflammation chemicals called cytokines. And those cytokines are what give you all of your Lyme symptoms, okay? So Having Lyme in you, your immune system overproduces cytokines. They give you Lyme symptoms. And if you happen to have yeast in you causing your immune system to make too many cytokines, that will increase your Lyme symptoms as well too. Okay. Other things to consider that indicate yeast would be increased sugar cravings, gassiness and bloating, vaginal itching, vaginal discharge, increased brain fog, and then also feeling a lot worse after you have sugar. Sometimes people with yeast have that problem. Okay, all right. The other thing that I have found in my when I was practicing in Seattle managing Lyme disease that would often lead to too many pimples or bumps that look like pimples would be being on the herbal medicine cat's claw. Cat's claw, either as cat's claw or sold by Nutramedics as a product called Cemento, has a side effect, an estrogen or a hormonal side effect that can lead to pimple development. Okay, and so sometimes I'd have to get people off of it because of the pimple problem. In terms of does Lyme trigger pimples, it's not my opinion. In all the years that I was managing Lyme disease, I didn't see that it was Lyme leading to pimples, but rather it was usually yeast or it was the medication, the Cemento or cat's claw that was responsible for that. Let's see here. Oh, cracks in the corners of the mouth actually can be from having too many yeast as well too. Cracks in the corner of the mouth sometimes can be part of a zinc deficiency, sometimes can lead to that as well too. So one thing to do for that it'd be to take, that I would have patients take if I thought it was due to zinc deficiency, would be to take zinc tablets, 20, 30 milligrams one time a day. You can get little lozenges that you chew on for that. Okay? All right. Thanks for that question. Good luck to you. Hello, Sue. Let's see. Will 50 milligrams doxycycline one time a day work in your pulsed regimens, or must it be 100 milligrams? Thanks for your well-packed quick order. Recently added in, I think you must order from our store. You're welcome. I've got a really good shipping department out here now. They've been doing a good job with that. So thank you for saying that. Let's see. Recently added Capri Plus for anti-yeast. Might it cause diarrhea? All right, let me kind of go through these one at a time here. So in terms of the doxycycline, my preferred dose for doxycycline is either going to be 100 milligrams or 200 milligrams all at once, okay? I start thinking that 50 milligrams gets to be a little low, okay? All right. In terms of diarrhea, occasionally there is a rule of thumb that I have in medicine, and that is that anything can happen to anyone with anything. All right. So what that means is there's the common side effects that people experience from medicines or herbs. And then there are the odd things that happen, not a lot, but they happen. Okay. I haven't seen anyone in the years that I worked with Capri Plus developing diarrhea from it on any regular basis. I would have an occasional person that would. And that may be a side effect and how your body is handling it. So if there is a problem with that, one thing you might want to look at is a different product. At my supplement store, Marty Ross MD Supplements, another product I carry that I have found useful for treating yeast is Phytostan, Phytostan. It's a product by Integrative Therapeutics. Sometimes people would tolerate that just fine on the rare instances where the Capri Plus would not be tolerated, okay? Everyone, Capri Plus is an herbal medicine made by a company called Karuna that has garlic in it. It's got caprylic acid, and it's got rosemary oil in it as well, too. It can be quite effective. All right, let's see here. Okay, so you said might it cause diarrhea, and then activated charcoal has helped. Do you recommend microchitosan? So basically, again, if it's giving you loose stools, I might think about changing it altogether. Okay, let's see. I'll be adding NT factor to repair mitochondria, transfer factor multi-immune to boost the immune system, alpha lipoic acid to detoxify, and Hutania and Sidacuta for Bartonella. Is it best to add one new product each week, or is it okay to add all at once? Do Do you recommend getting the new shingles vaccine? Thanks for all you do. You've got a lot of questions here tonight. So in terms of adding the type of supplements that you've mentioned here, in most people, I would have them add all at the same time. All right. Now, if I had a situation where I was managing somebody that happened to be the medicine sensitive person, somebody that always had sensitivities to medicines or herbs or supplements, I might add them in one at a time. Okay. So those would be just some general thoughts on that. In terms of the shingles vaccine, so the shingles vaccine, I had a brief discussion about this last week's webinar as well too. So many of you may be familiar that I am not a big believer in doing the flu vaccine. And the reason is that the flu vaccine, we know that a lot of people that have Lyme disease, when they get the flu vaccine, get worse with their Lyme, okay? And the issue also with the flu vaccine is that many seasons it just doesn't work well, right? So for instance, last year, the flu vaccine in the end only worked 30% of the time. That's based on information from the Centers for Disease Control, right? So in deciding about whether you're going to do the flu vaccine, you've got to weigh out risk and benefits, all right? So there's the risk of getting worse with your Lyme, and then there's the potential benefit of not getting flu that only happens about 30% of the time in last year's flu vaccine, right? So the odds there are pretty much that against doing the flu vaccine, unless we get into a killer year. Okay, now, in terms then of the shingles vaccine, shingles, everyone, is chicken pox that gets reactivated again, okay? So the chicken pox virus, after you've had chicken pox, can live along the nerve roots in the body and can reactivate. And it becomes a problem as you get over 65. I don't know the percentage on top of my head, but there is a percentage every year of everyone that has it that will get shingles. And the trouble is when you get shingles in an older person above 65 is that there is a risk of getting into a permanent pain problem afterwards, but also they can just be really, really sick from it too, okay? Now, in the case of the shingles vaccine, I don't know off the top of my head the effectiveness, but I put it in a category of pretty highly effective, okay? So it's not that low effectiveness that I store in my brain for what I remember for the flu vaccine, but it tends to be a higher effectiveness one. And so when it comes to somebody that is 65 years of age and older, yes, there may be some slight decline in how you're doing with your Lyme disease, but I think that there may be more of a dramatic problem that can occur if you get shingles. So generally, in that situation, when I was practicing, I was recommending that patients get the shingles vaccine at age 65 and older. Okay? All right. Thanks for the question, Sue. Good luck to you. Are those questions, I should say. Let's see. Did I get that all right? Yeah, I think I got through your questions. All right. Very good. Let's see. Hello, Deborah. Let's see. Thank you for doing these webinars. Oh, you're welcome. They're very helpful. You're welcome. I appreciate that. So those are, as you know, one thing that many of you may be interested in knowing about. I'm in the process. These webinars, again, I record them and I store them on my YouTube channel, which is Treat Lyme by Marty Ross MD. And I've decided to start moving most of the videos actually that I have at my information website, Treat Lyme by Marty Ross MD, onto YouTube as well too. So if you've been following my channel on YouTube, you're going to start seeing a lot more videos coming there. And I'm trying to make it more of a comprehensive YouTube channel as well too. So if you haven't, go ahead and check it out. I've been trying to figure out how to do this and add those videos and get them ready more in a YouTube kind of way. If you happen to go to my YouTube channel where I keep the recordings of the webinars, but also where you'll be starting to see a lot more videos that I have done, I'd appreciate if you'd subscribe. That way you know when I've put new things up, okay? All right, thank you. All right. Byron, let me see. We'll try to post this. We'll see. This is a long question. I think it's reaching the limits of what might not lock my screen up, but let's give it a try here. Oh, I'll be okay. It's squeezed in. All right. So, hi, Byron. Hi, Dr. Ross. So grateful. Thanks for your continued support and helpful information. You're welcome. Let's see. I was diagnosed with Babesia, Bartonella, and Lyme in October of 2018. I've been on Doxy. Then my LLMD added rifampin and monolaurin in January 2019 and have been on these since. Everything has been going well, neuro improvements, etc., but the continuous ringing in the ears that has not gotten better or worse starting antibiotics. It's more prominent at night. Does this suggest persistent Babesia? So let me just answer that. Actually, let me read the rest of your question. I'll come back and answer that. Let's see here. Does this suggest persistent Babesia? Also, my PMD has been doing monthly blood tests, checking my liver, kidneys since on rifampin and monolaurin, but have noticed my platelet count has been trending downwards. Was hovering around 350, now trending at 180 over the last 3 months of blood tests. Can this be due to being on rifampin so long or related to persistent Babesia infection? Okay, so I want to just handle a few things here. I'll come back to the rest of your question here in a minute. All right, so regarding ringing in the ears, it's also known as tinnitus. Sometimes it can be part of aging, all right? But if it wasn't there before Lyme, then maybe it is actually due, before your treatment, if it wasn't there so much, then one thing that I would have in patients that I would manage this, that I would try to figure out, was this a medicine side effect that might be causing it, okay? And so in terms of the medicines that you're on, the only one that and just looking at this, okay, the one I would wonder about is monolaurin potentially. And the reason I would wonder about that is monolaurin, one of the ingredients of monolaurin, there's 2 active antimicrobial ingredients of monolaurin. One of those is something called atovaquone, and there's another one called proquinol. Okay, proquinol is a quinine type derivative. And quinine-like medicines and quinine are known for causing problems with the nerves and also the hearing nerve in particular, okay, and which could be giving you some of the ringing in the ears. So that might be where that is coming from. I don't think of it as a Babesia symptom. It is possible, if it is related to the proquinol, that as you come off of it, it can take sometimes a few weeks, but that might reverse. That's something I would have you bring up with your Lyme doctor to see if they might have some alternatives for you to use instead of using the proquinol that's in there. Okay, all right. And as you know, I have a whole article about ways to treat Babesia. I'll show you that. There's ideas you could bring, but it could be that it is a side effect of the medication. Okay. In terms of low platelets, one of the things I have found in my practice is that unfortunately, any medicine, as I said, it can have side effects, but rifampin, although I like the antibiotic, it is an antibiotic that has numerous side effect potentials. And one of those can be low platelets. And so it could be due to the rifampin. My experience always is that when I got somebody off the rifampin at the end of treatment, or when we decided not to use rifampin anymore, that would come back up again too, okay? Occasionally, I have seen doxycycline cause low platelets as well too. Where you're sitting with that number, and as your doctors seem to be managing this as well too, it's getting lower, but it's still not a level that is a threatening level. Okay, and it sounds like they're continuing to use it. I often in situations like this would continue to use the medications without making a change. Okay, all right. Let's see. I don't think those low platelets are due to the Babesia. Okay. Let's see. I had normal iron levels before and during being on antibiotics. Then in April, May 2019, my TIBC, total iron binding capacity, everyone, has been dropping. Currently 170, should be above 240. But ferritin, total iron, and percent saturation, and your blood testing are all in normal range. Does this suggest Babesia or something else like a parasite or GI-related candida? So my impression of total iron binding capacity means how iron is held in the body, okay? And it attaches to various kinds of proteins, and in addition, it's stored in a form called ferritin. Looking at the rest of the blood tests that you have there suggests to me that your iron levels are actually probably okay. This might be that your liver is having a harder time making enough of the proteins, the various kinds of proteins that bind iron and come up with that total iron binding capacity number, okay? In the end, though, you obviously are having enough iron to make your blood cells and to do other things. I'm not sure if it's a problem. Okay. All right. Again, that's something you should be discussing with your physician as well, too. Let's see. I have been to a GI doctor and he told me it could be SIBO, but doesn't believe in Candida. Not sure what to do next, or should be concerned about the antibiotics in the body. Thank you for your advice. Let's see here. I think I missed part of this. Oh, you had a high eosinophils. So I don't know. So eosinophils are a type of white blood cell that sometimes will go up when you have parasite infections. Not all the time. Sometimes they're just elevated on their own. I'm not sure if this is a candida issue or not. I guess it'd be hard for me to answer that totally. Okay. All right. But I hope I gave you some insights that are helpful. Discuss these ideas I just said with you, with your physician though. Okay. All right. I want to just do a quick screen share here and show you and everyone the article that I have about how do you treat Babesia. Let's see here. Let me go back here. All right. So as you all know, my information website, my Lyme disease education site is Treat Lyme by Marty Ross MD. And the center, a piece of the website is this online Lyme guide, okay? All right, in here, you can find a section that addresses most problems that people develop with Lyme disease. And one of those tabs is my infection treatments plans. And here, I would take a look at this article called Kills Babesia, a brief guide, okay? And I give you various options to look at in terms of how you build a Babesia treatment, okay? You have other options besides doxycycline and monolaurin, okay? All right. All right. All right. Let's see here. Hello, Colleen. Hi, Dr. Ross. 4 years ago, I tested off the charts high for mercury via your hair sample test. Doctor prescribed 2 supplements made by the company standard process. Parotid PMG, which is a parotid gland extract, and colloidal with purified bovine salt. Okay. The following year, my mercury levels were normal on the hair sample test. I later read that a hair sample test isn't necessarily accurate for how much mercury may or may not be in the brain. I've also read that fat-soluble chelators will not cross the blood-brain barrier, and that first you should chelate from the tissues for 4 or so months, but it's still in the brain unless you do the other type of chelation called alpha-lipoic acid, which crosses the blood-brain barrier and takes 2 to 4 years. What do you think about all this? I'm treating Lyme, Bartonella, and Babesia, many neurologic issues. Thank you so much for your help. Okay, so let me talk about testing for heavy metals first, okay? So there's 3 ways that you can look to see if there are heavy metals in you. One is a blood test, okay? Another one would be a hair analysis like you had done. And then a third way is something called a chelation challenge test, where you take a chelating agent first and then you collect urine afterwards, okay? Now, all right, so those are the 3 ways, okay? Now, I want to just make a point and then I'll describe how those are different, okay? So the thing about heavy metals is when you breathe them in, drink them in. So heavy metals are like lead and mercury. Those would be the common ones. There's other ones too, okay? But when they get in you, the majority of them actually get peed out right away. They're out of the body. They don't bother us, okay? What we're more interested in is the ones that get stored in you, okay? And what happens with heavy metals is the ones that don't get out of you, you don't pee out right away. They wind up getting moved into your cells, and where they are like to migrate to are parts of your cells that have a lot of sulfur in them, all right? The area of the cells that have a lot of sulfur in them are the energy factories called mitochondria. So inside of our cells, every cell has about 300 to 400 mitochondria. Inside mitochondria is where sugar and fat are burned through a bunch of chemical reactions to create cell fuel, all right? And so if there's too many heavy metals, they go to the sulfur in these mitochondria, and the sulfur is found on the enzymes that fuel all these chemical processes. So basically, with heavy metal toxicity, you become energy starved. All right, so your nerves don't work right, your gut doesn't work right, you have low energy, etc. You have neuropathies from it as well too. Okay, all right. So what we're interested in is what is stored inside your cells. All right, I'll say that again. Okay, now if you do a random blood test, that probably is going to do a better idea of showing what you have been exposed to maybe over the last 24 hours. Okay, because remember I said, once you breathe them in, eat them in, drink them in, they get absorbed into the bloodstream, the blood goes to the kidneys, and the majority of those get peed out. So blood test maybe represents the last 24 hours of what you've been exposed to. Probably not a good indicator of what's in the cells, all right? All right. Hair analysis. Hair analysis is, we'll show you, so your length of your hair, all right? Mine's a little bit shorter, but the length of your hair represents how much, basically represents the amount of time that you might be measuring that exposure, all right? So hair analysis might give you an idea of what kind of heavy metals you've been exposed to, mainly from your environment, actually, not from your own cells, over the last 3 to 6 months, all right? Okay. What happens when you do a chelation challenge test, which is the way that I always preferred to look for heavy metals, is we have you take an agent like a DMSA, for instance. It's a prescription medicine that is a metal magnet. It will draw heavy metals out of your cells, okay? And then afterwards, you have you pee, then we measure those, okay? That's probably a more accurate way of figuring out what's going on in the cells, all right? Now, I do not agree with the opinion that ALA is the only thing that's going to get out of your brain. Actually, I think DMSA can do it as well too. Okay, I don't think that alpha lipoic acid is the only way to do that. I know some people write that, but they don't have science that shows that. Okay, all right. I just want to be clear about that. So I guess what I would say is I think you need to go back and figure out whether you even have a problem with heavy metals. All right, and that would be to find somebody that can do a heavy metal chelation challenge test for you. Okay. All right. And I don't think that, and I'm not quite sure what your physician was using with these. The parotid PMG is really going to be something more to support your hormonal systems, which is not about doing chelation. And I would not necessarily call Colicol one of the best chelators. Okay. I wouldn't call it that. So I'm kind of critical over what might have been tried with you before for this. Okay. All right. I'm going to do a quick screen share here, and I'm going to show you an article I have about testing for heavy metals. You can come back and take a look at it later. So I think I stored it away in the detox chapter here. Yeah. So here's the article I have about heavy metals. It's called Heavy Metals, the Problem and the Best Test. I believe I've got a video that goes with that too. Yeah. So I would go ahead and take a look at that. Okay. All right. All right. Thanks for the question. Good luck to you. Hello, Kim. Let's see. Hi, Marty. Thank you for taking my question. You're welcome. Let's see. My daughter, 9 years old, was treated for Lyme and co-infections for a period of time and is doing relatively well. I'm glad to hear that. She is, however, dealing with chronic yeast rashes on her bum and armpits, strong sugar cravings, weight gain, bladder irritation, frequent urinating pain in the bladder, and symptoms of weak legs, sore eyes that comes and goes. Do you think that her symptoms aside from the rash could also be yeast related? Her rash clears with Lamisil terbinafine cream combined with Loprox, Cycloprox creams, but consistently returns once we back off the daily application. Would you recommend an oral yeast treatment? If so, what and for how long? By the way, we miss you and look forward to your returning to practice. You are the best. Thanks, Kim. I appreciate that. So on that note, everyone, I don't know if you noticed, but so I slid into my last video article the fact that I'm anticipating a return to practice in Seattle. I've decided to go back to Seattle. And that's the return to practice is probably going to be towards the end of this year and early 2019. So I plan on being here in Austin for about another month or two, and then we'll start working my way back to Seattle. But by the time I get myself established there and then find a place to put the practice and then get the furniture for the practice, I mean, it's going to take time. But I am anticipating doing return back to clinical practice as the medical board has decided to leave me alone. And so that's good. And they've totally freed up my license. It's free for me to go back and practice at this point. Okay. So that's what Kim is referring to. Anyhow, so Kim, in terms of symptoms, so the rash is more of a topical manifestation of yeast, but bladder irritation can sometimes happen with yeast overgrowth. And that is because the yeast on the outside will start working their way up into the bladder. In terms of, and if she's got chronic yeast on her skin, knowing that she at one time was on a lot of antibiotics before, there is a good possibility that she may have too many yeast in the intestines as well too. And from the symptoms that you list here, the skin rashes make me wonder that. The strong sugar cravings make me wonder that. Weight gain, probably because she's eating more because the yeast are asking to be fed in a sense, okay? And then if she's getting some symptoms of weakness, that might occur also in somebody with Lyme, that can suggest that that there is an increase in a cytokine production as well too. Okay, all right. So I don't think that topical agents, if she keeps getting repeated yeast infections, I suspect that the topical agents are only handling what is topical. Okay, all right. Now, because this is a webinar format and because I'm sitting in Austin, Texas, where I don't have a medical license, and I'm not back in Seattle yet, I cannot tell you specifically what to do, all right? Other than I would suggest talking to her naturopath or her other physician and tell them that I said based on symptoms, I'm questioning if she has a systemic yeast overgrowth, intestinal yeast overgrowth. And then you could show them the article I have about what do you do for that. Okay, I'll show you that here in a minute, but you print that article off and do that. But it's something you should talk with their physicians about because I cannot diagnose or specifically treat while I'm sitting here in Austin, Texas without a Texas medical license. Okay, all right. So let me show you that article here real quick. All right, so let's go back into, we can take a look at the yeast chapter here. So in terms of things to get rid of yeast, there are prescriptions and herbal options. And these are things you could literally just, if you wanted to, you could right click your mouse on this article and then print off just the text here, okay? All right, and bring that to your doctor. I talk about prescriptions. I also talk about herbal options in here as well too. All right? Okay. Thanks for that question, Kim. Good luck to you and good luck to your daughter too. All right. Hello, Charles. Let's see. Hi, Dr. Ross. I have neurologic Lyme and many co-infections. I feel it mostly in my chest. Could the chest bones be infected? That is what it feels like. So Charles, one thing I would say is everyone with Lyme has different manifestations, okay? And that often pain means there is inflammation. So one place that Lyme inflammation can occur is right up along the chest joint. So you got your chest bone right here. Right at the edge of the chest bone are joints where the ribs meet the chest bone, okay? And every place where a rib meets your sternum, your center chest bone, is a joint. Lyme likes to live in joints. The reason it likes to live in joints is joints don't have good blood flow. Lyme likes to live where there is not a lot of good blood flow because oxygen in blood is very toxic to Lyme and kills it. All right, so Lyme's designed to survive. All right, so often that can be pain in these areas from the inflammation in the joints. All right, In terms of my experience is that Lyme actually doesn't necessarily infect the bones, giving bone pain that way. All right. Usually it's more of a joint related problem. The other thing is there's lots of muscles in here too. Lyme can live in the covering of muscles and give lots of inflammation in those muscles as well too. All right. So it's very possible that this is infection related due to inflammation, and also inflammation within those chest joints where your ribs meet your sternum. Okay? All right. Good luck to you. Hello, Charlene. Hi, Dr. Ross. Congressman Chris Smith passed in the House, and now it is in the Senate. Tell DOD to investigate the bioweaponization of ticks. It involves Operation Paperclip. Yes, Charlene, I'm very aware of that, and but thank you for bringing that information here. Yep. Hello, Teresa. Let's see. I had a surgery May 14th. White blood cell count was 39 on admission. Had 5 blood transfusions left. White blood cell count at 29 and holding. Do you see Lyme patients with elevated white blood cell count? Sounds rare. Burrisgano writes, it is especially important to look for elevated protein in white cells, which would dictate the need for some more aggressive therapy. Hemodoc is checking for lymphoma. I suspect Lyme. I read a PubMed. They found a patient with Lyme in bone marrow, which elevated white blood cell. Not seeing a lot on it. Thank you. So Teresa, my experience is I usually people with Lyme have the opposite problem, which is low white blood cells. Elevated white blood cells sometimes can be due to lymphoma. I mean, I can understand why your hematologist, oncologist is taking a look at that. Also, it can just be a sign of infection. So I would hope that you've talked with your surgeon again to make sure that the various surgical sites are not having chronic low-grade infection as well too. So to answer your question, yeah, it is possible. I think there's rare that you can see elevated white blood cells from Lyme infection. It's rare. It does happen, but before that's almost going to be what I would call my experience would suggest that is a diagnosis of exclusion, meaning you have excluded all the other big monsters that medical monsters that can be leading to elevated white blood cell counts, like other infection, maybe of the surgical sites, for instance, and other cancer possibilities. And only then, after those things are excluded, then you might start thinking it could be due to Lyme. Okay, that would be my experience on that. All right, all right. Good luck figuring that out. Okay, all right. Hello, Suzanne. Yay. Hi, Marty. Thanks for your yay. I appreciate that. Happy to have you here in Texas. Thank you. Just wondering on some mild jerks and how accurate is DNA Connexsions with Bartonella. So I do not like DNA Connextions. All right. So everyone, there's a laboratory called DNA Connextions. They do a urine test using a method called PCR to see if you might have the DNA of various germs in you. Okay. So they do urine PCR testing for Bartonella. A PCR is a method we use to amplify the DNA from a germ. It's called polymerase chain reaction. All right, that's PCR, but it's just a way of amplifying DNA to see if you can see it. All right, and so so they do PCR testing for Lyme, Bartonella, Babesia. The problem I have with them is they've never, unless something has changed, they haven't verified their test as to whether it's accurate or not. All right. So there's something that labs will do when they develop a new way or they come up with their testing is they'll do some in-house test where they find people known through other ways to have an illness, and then they see how good is their test at figuring that out. It's called a validation study. All right. And so DNA Connexsions hasn't done validation studies. I had actually a number of years ago talked to somebody in the lab about that. And the reason I had called them is I was getting people coming to see me with results saying they had Babesia and Bartonella, for instance, but I saw no symptoms in many of these people suggesting Babesia or Bartonella. All right. So with any test, the chances are that a test is correct goes up with the number of symptoms you have of that illness. Okay. There's something in testing we call predictive value. And that is the ability of a positive test to truly indicate that you have the illness. All right. Predictive value. Okay. And the predictive value goes up higher if the more symptoms you have of the illness. All right. So I was getting all these patients coming in with DNA Connexsions tests. And the reason they were coming in is I tended in my Seattle practice to be a referral doc. A lot of the naturopaths or other physicians, when they were having difficulty figuring out what to do with the patient, they would have them come see me. All right. So these people were bringing in their testing from other physicians. DNA Connexsions had done a great job of getting their testing out through the naturopathic doctor community. Okay. I don't think they've done quite as well getting MDs to accept their test, but in the naturopathic community, they did a great job of marketing their efforts. All right. So my problem with DNA Connexsions is I don't think it's accurate. All right. That's based on my own clinical experience with their Bartonella and their Babesia testing. Their Lyme testing, I think, may have a greater chance of being accurate, but not for those co-infections. I am just not a big believer in that lab. All right. All right. I've talked with some of my colleagues about that. They have similar experiences as well, too. Okay. All right. Some of my Seattle colleagues, I should say. All right. Thank you, Suzanne. Good luck to you. Oh, Suzanne, one other thing. There is an article I have about how do you diagnose Bartonella. All right. And in there, if you are going to do, I recommend in that article to really follow what your symptoms tell you. If there's a lot of symptoms, Bartonella probably is Bartonella, right? But in terms of Bartonella testing, probably the best lab out there is a lab called Galaxy Labs that does an enhanced, they call it an enhanced PCR technique, okay? And they have the ability in their testing to look for all strains that infect humans, which are 15 strains, okay? The DNA Connexsions, I think, is only looking at 2 strains. So they're going to miss a lot of the stuff that's out there as well, too, all right? Plus, I think they're having false positive tests as well, okay? All right, let me show you that article real quick. All right, so take a look in the how to diagnose chapter here. Yeah, take a look at this article. Is it Bartonella? How to diagnose, okay? And I go through the ins and outs of testing and why symptoms probably are the most reliable way to look at this one, okay? All right. All right, let's see here. Hello, Miranda. How long do you recommend taking cholestyramine for either mold toxicity or Lyme mycotoxins? Is there any reason not to take it long term? So it's a good question, that not to take it long term. All right. So the reason to take it is if you truly have mold toxin or Lyme toxin illness issues. Okay. So mold toxin illness, everyone, is an illness that affects probably 25% of people, have a genetic predisposition for it. And that's 25% of all people, not just Lyme disease people, but of all people, all right? So there's a physician named Richie Shoemaker out in the East Coast who's been able to show that 25% of all people have a genetic programming error so that when they are exposed to mold toxins, they are not able to remove them from their body, okay? All right? And what is supposed to happen in 75% of us is that our immune systems will see those mold toxins that have gotten absorbed into the bloodstream, and they will tag them to be removed, okay? All right. And once they're tagged to be removed, the immune system will break them down, and they get peed and pooped out in a broken down form, okay? Now, if you're one of the 25%, what happens is those mold toxins are fat-based toxins, and things that are fat-based go to the liver to be transformed and detoxed by changing the fat toxin into a water-soluble, water-dissolving toxin, all right? And so what happens is that doesn't take place in people with mold toxicity illness. So these fat toxins from mold go to the liver, and they come out still as fat toxins. They go out into the intestines, intestines, they get absorbed right back into the bloodstream. You just get this endless loop. Cholestyramine will bind those up. It's a fat sponge. It binds them in the intestines so that they get pooped out rather than recirculating. Okay. All right. Now, there are some people that have mold toxin illness that mainly they have a one-time problem. They got exposed. They were living in a bad environment and they got exposed to bad mold. And that once you detox them over a 2 to 4 month period of time, that's it. They're done. They're completely well. Okay. And I've had patients like that in my Seattle practice. All right. There are other people that once they get detoxed all the way, that if they get more mold exposures, it's going to make them very sick. All right. And so there's a couple ways that I have seen people do this. All right. So one of my best responders to mold toxin treatment ever is probably have seen some of her information online because she's got a really wonderful video from the years ago when she was just terribly impacted by this. But she was a Canadian patient. It's okay. I can talk about her. She gave me permission to. Okay. But she actually has found that since she got over her mold toxin illness, that about every 6 months to 7 months, she starts feeling symptoms creep back in. And I think for maybe about a week or so, every 6 or 7 months, based on symptom creep, she'll wind up doing cholestyramine during that period of time. Okay. All right. There are other people that I had worked with in my practice in Seattle that we would wind up finding a regimen that would keep everything under control. In other words, it would keep up with what they were getting exposed to from their environment. Okay. Now, having said, and that might be taking 1 scoop 1 time a day for some people. Right now, the issue is that maybe long term this could be lowering cholesterol. All right, cholesterol is needed to make hormones in your body. All right, but I don't think at 1 time a day there is dramatic long term problems from doing that. All right, in other words, I think it is something that can be used long term. Okay, all right. Thanks for that question. So for those of you that are wondering, because I just said mold toxin illness, I just want to let you know, mold toxin illness looks a lot like Lyme disease. And in fact, I have had patients where they had positive Lyme testing and they came to see me because they had positive Lyme testing. But when I started taking their history, I discovered that even though they had that positive testing, they didn't get sick until they lived in their house full of mold. And sometimes what I would do in situations like that is I would just detox them from the mold. They would get so well that we would never have to do anything about the Lyme infection because their immune system was keeping it under control. Okay. So to see if you have mold toxin illness or to read more about mold toxin illness, how you can test for it, what binders are, etc., take a look at this article called Mold Toxin Illness in Lyme Disease. Okay. Thanks for that question, Miranda. Good luck to you. Hello, Cindy. Is late Lyme more successfully treated if there are no co-infections? My IGeneX test said no co-infections. Okay. So, Cindy, there's a lot of factors that decide if it's going to be difficult to treat Lyme or not. I think the biggest factor is how well does one's immune system work, okay? And some people have a genetic predisposition where their immune system doesn't work well, and some people have immune systems that work better. One other thing that gets in the way is there are some people that have a lot of stress and unresolved issues from their life, and I have found that those things suppress the immune system in a way that somebody has a hard time recovering too, okay? All right. So stress and unresolved issues basically sometimes can really suppress the immune system and make it difficult to get over Lyme. And in addition, if you happen to have co-infections, they can make it difficult to get over Lyme as well too. Okay. Now, in terms of testing, you should take a look at the article I have about both Bartonella and Babesia diagnoses. The testing for both of those illnesses is not that accurate. And in fact, my recommendations for my patients and what I found successful in my practice in Seattle was to make decisions to treat for those 2 co-infections, Bartonella and Babesia, based mainly on what the symptoms said. Okay. All right. So I'm going to show you 2 articles that you can take a look at so you can start working with your physician to decide whether you do or don't have those infections, all right? So let me go ahead and do a screenshot here. All right, so take a look at the chapter I have on how to diagnose right here. All right, and one of these articles I showed earlier, that's this, is it Bartonella? I talk about how do you make a diagnosis based mainly on symptoms, all right? And I make the same argument in this one called How to Diagnose Babesia. And actually, I'm just looking here. I think I have a video with this one too. Yeah, I've got a video on that one as well too. Okay, all right. All right. So I hope that gives you some insights to take a look at. Okay. All right. Thanks, Cindy. Hello, Miranda. See, many recommended a Lyme diet of no gluten, dairy, or sugar. What are your thoughts on this? I tried this diet for a few months and lost a lot of weight secondary to limitations of this diet. I incorporated gluten back in after testing found I'm not sensitive. How important is diet and Lyme treatment? Also, once in remission, do you have to continue? All right. So, in general, the diet that I have found, well, actually, let me rephrase this. There is no one ideal diet for everyone. I want to just start by saying that, okay? All right. But in general, in my practice in Seattle, Washington, I found it was useful to have people eliminate gluten and also to be on more of a paleo type diet. So a diet rich in fats and proteins, and good quality fruits and vegetables as well too. Okay, all right. I want to explain why. All right. Now, having said that, I also want to let you know they didn't work for everyone. Okay, but in general, those were the diet ideas that I had. Okay. Now, all right. So Lyme disease is full of inflammation. It's an inflammatory illness. Okay, and even though people may have not have a full-on gluten allergies, gluten in some people is inflammatory, all right? So one way, and a lot of people actually, is inflammatory. So as a means of trying to decrease inflammation in the body, I often would recommend that people remove gluten as well too, okay? Now, one way to find out if gluten really is a problem for you, separate from the testing that you had, because the testing isn't necessarily going to show if gluten is inflammatory in you, okay? If you're sensitive to it that way. The best way I found to do that is to do something called an elimination diet. And what you do in an elimination diet is you take things that you think you might be sensitive to and you remove them, all right? You just get rid of them for 3 weeks, all right? And and 3 weeks is critical. That's the amount of time it takes the body's inflammatory system to quiet down and to unlearn to be less sensitive to, when you're exposed to something that you're sensitive to, the body will eventually stop being as sensitive. When you stop it, it becomes super sensitive, okay? So at the end of 3 weeks then, you add back in the gluten. And you see, do you feel a lot more achy and more fatigued in the days after you add gluten back in? And if you do, it means that you are sensitive in a way that the blood testing is not picking it up, okay? So gluten, some people can tolerate in their Lyme treatment. A lot of people can't because it tends to be inflammatory. The best way to find out is just strip it out for a few weeks and then add it back in and see, do you get a lot worse when you add it back in? Okay, all right. All right, now the reason for a paleo type diet. So paleo type diet tends to be low sugar, okay? So it's low in beans, legumes, white breads, all right? The main carbs that it has in it come from fruits and vegetables. And the reason that this type of diet can be better is it is a diet that is more supportive of the functioning of your cell energy factories called mitochondria. And often in Lyme disease, as a result of chronic infection, there is an excess oxidizing state in the body. There's a lot of extra oxidation agents. And those oxidation agents can damage the functioning of your mitochondria. So a lot of people with Lyme have mitochondria dysfunction. A paleo diet seems to help mitochondria function, all right? Second reason to consider a paleo type diet when you are in the middle of a Lyme treatment is that most likely you're going to be on herbal and prescription antibiotics, which is going to increase your chances of getting too many yeast in your intestines. A paleo type diet, a low carb diet, tends not to feed yeast as much, and so there tends to be less of a chance of getting it. Okay, all right. So I'm going to show you two things to take a look at. And others as well too. It'll give you some information here. All right. So again, one of the things that I said is that if you're wanting to find out if you're sensitive to something like gluten or maybe even something else, the thing to do is what's called an elimination diet. And so take a look at my nutrition section here. And I have a whole article on how to do an elimination diet. What foods do we generally, if we're trying to figure out if somebody's like super sensitive to a lot of foods, this just is a way of stripping out all those out, okay? I have some how-to documents in here, et cetera, okay? And then the paleo type diet that I have is this one right here, okay? So those will be two tabs for you to take a look at with the rationale built into them as well too, all right? All right, thanks for that question. Good luck to you. Oh, let's see. Once you're in remission, you probably, my sense when somebody's back in remission and they're doing well, they don't have to be as restrictive with their diet. Okay, that's just been what my experience is. All right. Let's see. I've got people that have posted things twice here. I'm just trying to get rid of them. All right. Hello, Sherry. Let's see. Hi, Dr. Marty. Thank you for all the time you devote to helping people with Lyme. You're welcome. My husband and I have Lyme, Bartonella, Babesia, decani, and chronic inflammatory response syndrome, which is CIRS. Okay. CIRS, everyone, is a term that Richie Shoemaker, who I mentioned with mold toxin illness, coined. I'm not quite sure if it's a real condition or not, to be honest with you, because as I tried working with it, I didn't find much benefit in treating for it. But what it means is that after you've removed your mold toxins and maybe after you got rid of your Lyme infections, you still remain very sick. And what Dr. Shoemaker hypothesized, he doesn't have great science to support it, but hypothesizes is that basically having a mold toxin illness or having chronic infections sets off a chronic inflammatory response in the body that basically just starts taking on a life of its own. Now, Dr. Shoemaker has various steps he proposes to help correct that. Again, in somebody with chronic Lyme, I just never found it to be that useful to do all those steps. I just did not, okay? Anyhow, that's my thought on that. All right, the dominant symptoms for my husband seem to be from Babesia. He does not want to use antibiotics because of past bad experiences. He's taking cryptolepis, Cidacuda, ABABs, Zhang's Artemisiae, and activated charcoal for Babesia, chronic inflammatory response syndrome. He wants to pull some of the antimalarials because staying in them long can cause some bad side effects, and pulsing can keep it guessing. He wants to pulse them without taking breaks and continue on the herbs throughout. For example, he would take monolaurin for 7 to 10 days, then take quinine for 7 to 10 days, then primaquine and hydroxychloroquine, something like that I don't know. You don't like pulsing for Babesia, but hoping with continued pulsing and herbs, it could be beneficial. What do you think? Second question is, I feel like so about that, I don't like pulsing medicines for Babesia. I've never worked in that kind of a fashion, that kind of rotation, because I'm not sure that it would be helpful for him. Okay. The only medicine I have found helpful to pulse in Babesia is artemisinin. And that's because the intestines develop an enzyme that can deactivate artemisinin after you've been on it for a few days. So I found it helpful to use it maybe 3 days on and then take about 11 days off. That seemed to work okay for artemisinin. And then when you use the artemisinin, you got to use it at high doses on those 3 days. But in terms of that rest of that regimen, I would be suspicious of it, at least based on my experience. Okay. Let's see. Second question. I feel like I can never get up to full doses of medicines or eradicate infections because the herxing is so bad. It does not allow me to function well, especially on anti-Babesia medications. Could this be because of having chronic inflammatory response syndrome? I follow all of your other recommendations, etc. Okay, so there are some people. So I'm not. I know that somebody's diagnosed you with chronic inflammatory response syndrome. I'm just not a big believer in the utility of that for somebody with chronic Lyme infections. Okay. Now, what I have found in my practice is that there are some people that do have detox issues, I believe, that not only do they have issues detoxing mold toxins, they may have issues detoxing medicines out of them as well too. We don't have good tests for that, okay? So what I have found in people that are really medicine sensitive, that I was never able to get them up to a full dose on certain things. The reason I think that could be is that what determines a blood level, a medicine, the amount that's in you that actually is killing, is dependent on how much do you take and how quickly do your kidneys or liver, depending on the medicine, remove that medicine, okay? All right, so in some people, their detox mechanisms are just so impaired that they don't remove what they take that quickly. And so therefore, they don't need to take as much to have a good killing level in their blood, okay? So for instance, I once worked with a Canadian patient that was very, very sensitive to everything. And we were able to get her over her Bartonella by using, I think it was just 2 drops a day of Siddha acuta and 2 drops total a day of Hutania. And many of you know, in my practice, what I was recommending for patients that I found effective, and I recommend on the Lyme information site here as well too, is that Hutania should be dosed at 30 drops twice a day, okay? And that Siddha acuta should be at 1/4 to 1/2 teaspoon 3 times a day, all right? So those are the doses I found effective for most people. But in this one person, we did it with 2 drops of each twice a day, and she had severely impaired detox systems, all right? So in her, I think that those drops a day were getting sufficient blood levels to kill. And that's what you're ultimately interested in, okay? All right. Thanks for that question. Good luck to you. Hello, Faye. Hi, Dr. Ross. While under your care, I did peripheral neuropathy protocol and also took DMSA for 6 months for lead levels of 45. The neuropathy protocol did not work. We decided to treat the lead for 3 more months to get levels down to 10 as they were at 15. It went to 13, so I did another 3 months and levels went up to 16. Do you think I should continue the DMSA, and if so, for how long, and then do the neuropathy protocol again? I'm also on transfer factor L plus on CoQ10. Thank you for all you do, Faye. All right, so Faye, unfortunately, because I am sitting here in Texas, I cannot tell, where I am not licensed to give medical advice. I can't give you direct medical advice. I can give you some observations, okay? So I can't speak specifically to what you should do with this. I can give you some things to talk over with your physician, all right? So there are times in practice I found, and mostly in menopausal women actually, that the longer we chelated somebody, they actually started having increased amounts of lead show up in their blood levels, okay? All right, so keep in mind where lead gets stored in the body is one place that's a big bank for lead is bone, all right? And women, as you know, when women enter menopause, they sometimes also, due to the lack of as much estrogen, will develop osteoporosis or thinning of the bones, or osteopenia, which is not full osteoporosis, but some thinning of the bones, all right? So what happens is if the bone is breaking down more quickly than it's being made, some of that extra lead that is in the bone lead bank can work its way into the bloodstream, and it can start showing up as elevations, all right? So if that is what's happening with you, and I can't say for sure, one thing that I would do is do some things to help stabilize the bone mass. And things that can stabilize bone mass are weight-bearing exercise is one thing. Being on calcium is another thing. Sometimes being on estrogens can be helpful for that. But again, you have to talk with your providers about that. And then also being on, there are a group of prescription medicines that help decrease bone breakdown. They're called the biphosphonates. And then there is an herbal version of that, and I am going to blank on the name of it right now. Hopefully it comes back to me. I'm going to just make a quick note here, but I am blanking on. There's an herbal medicine that will help keep your what are called osteoclasts from breaking down your bone and sending that lead back up into your bloodstream. Okay, and I am just honestly blanking on it here. Hopefully it comes back to me. All right, I'm just making a note here. Actually, let's do this. We'll do a screen share together. I'll see if I can figure it out real quick by looking online here. Again, it's just slipping my mind right now, but I want to give the herb name to you so that yeah, I got it. I just figured it out. It just came to me. The herb is called ipraflavone, IPRAFLOVONE, and the person that writes a lot about it is a naturopathic doctor named Tori Hudson. That's TORI, last name Hudson, HUDSON. She's a women's health specialist out of Oregon, but has books about this, okay? Books about menopause and books about osteoporosis. So ipraflavone, this again, it's something I would discuss with your providers that you're working with right now. I have found in situations like this helpful to stabilize the bone mass before doing further testing. Okay? All right. Thanks for that question, Faye. Charlene says, have a good 2 weeks off. I will. Thank you. Let's see here. Hello, Frank. Let's see. Hi, Marty. Thanks for your webinars. What do you think of clarithromycin rifampin for Bartonella? I notice it is not on your treatment plan. Yeah, it actually is. I'll show you here in a minute. You may have missed it. So clarithromycin is also known as Biaxin. Okay. So what works best for, at least I think it is, we'll look at it together and see. So what works best for Bartonella are intracellular antibiotics that get inside of cells, okay? And both rifampin and clarithromycin are intracellulars. Many of you know, if you've read information that I have about how to treat Bartonella at Treat Lyme by Marty Ross MD, that my article lays out various combinations, and that I believe that probably the best way to get rid of Bartonella is to use at least 2 intracellular antibiotics at the same time. Both of these would fit that bill. Okay, let me show that to you real quick here. Or let's look together, make sure that I somehow didn't miss putting it in there. All right, so let's see, we'll go to the infection treatment plans here. All right, so my article on Bartonella is Kills Bartonella Brief Guide. All right, so in terms of combinations that you can use, that is true. Yeah, here it is. So what I say in this section so this is rifamycin or rifampin, okay? The issue with clarithromycin is it is something you can use. It's 500 milligrams 2 times a day. But the issue is that the rifampin may decrease in some people the clarithromycin levels, okay? And so for that reason, it wouldn't be my first thing to try, but I did use it successfully in a lot of people. the only way to really know if it's going to work or if it's giving you substantial reductions is to try it out and see. Okay, there's not actually a good blood test to measure the clarithromycin levels, but because rifampin can sometimes lower clarithromycin levels in some people, I put it down here as something else you could consider doing if these other 3 medications are not an option with your rifampin. Okay? All right. All right. Thanks for the question, Frank. Good luck to you. Frank, I have to tell you, I did use that combination often, though, but it would be more or less I would go to it if other options were not being successful. Okay? All right. Hello, Anne. Let's see. Thank you so much for your time here each week. You're welcome. Let's see. How long maximum do you feel people should stay on pharmaceutical antibiotics before they should either take a break or transit to herbals? My LMD is great, but doesn't believe in herbals. I've been on antibiotics for 8 months straight, and I'm feeling a plateau and worried about developing GI issues. Your thoughts? So the using herbals or prescriptions often comes down to a personal choice. Okay. Most MDs are going to lean towards prescriptions because they just don't have experience working with the herbal medicines. That's the main issue. What I can tell you is when it comes to the Lyme infection, the Lyme germ, we have some herbal options that can be as good as prescription options. And the main ones would be for the Lyme germ would be to use cat's claw and otoba bark. Clinically, I found them to have as good of a chance of helping as prescription antibiotics. Okay. Now, in looking at your decision, be aware that for Bartonella, that I do not think that the herbals tend to work as well as the prescriptions. Okay. But they can still work. So herbal option for Bartonella, doing a Sida acuta and a Houttenia together, those will work about 70-75% of the time versus a 2 prescription medicine option for Bartonella tends to work about 80-85% of the time. So you got about a 10% effective difference, okay? All right. Babesia, the herbal options of either using a cryptolepis or an artemisinin or using both of those together tends to work about 75-80% of the time versus the prescription options for Babesia will work about 80-85% of the time, all right? I do agree that the prescription antibiotics tend to create more GI intestinal problems for most people. All right, but sometimes, but the way to keep up with that is to try to just keep putting in more and more probiotics. Okay, so there's not a right or wrong here. You've got to decide. Is the risk of GI interruption of the good bacteria by antibiotics more of a problem potential for you versus the potential that for Babesia or Bartonella, if you go herbal for those, that it may not work as well. All right. Often what I would do with patients in my practice is we might, if they had the Bartonellas, they had the Babesias, because the prescriptions tend to work better for those, I would use those. But when it was time to be done with those, then we might switch over to herbal options, especially in somebody that had more of a preference to go in that direction as well, too. All right. Okay. In terms of those herbal options I just mentioned, take a look at Kills Babesia for the herbal options. Take a look at Kills Bartonella, a brief guide for the herbal options there. And then in terms of herbal options for Lyme, the Otoba and Cat's Claw, I have a whole article about that that you can, I'll show it to you here in a minute. There's another herbal option that I don't think works quite as well as Otoba and Cat's Claw, but still works fairly well. And that's to use a product that has multiple herbs in it called Biocidin LSF. Tends to do a pretty good job as well, too. All right. Let me show you information about those real quick. All right, so take a look at this section called anti-germs, all right? So here's my article on otoba bark extract and cat's claw, and then here's my article on biocidin, okay? Both of those are reasonably good alternatives to doing prescription antibiotics when it comes to the Lyme germ, okay? All right. All right. Thanks for that question, Ann. Good luck to you. Oh, in terms of GI issues, what is really beneficial to do when you're on herbal and or prescription antibiotics, because even being on herbs, you may still get some interruption of the good bacteria that lie in the intestines. Even on herbs, it can happen, okay? Is to make sure you're doing a good mix of two kinds of probiotics, all right? So one kind of probiotics, a general kind out there, are made up of bacteria that come from human intestines, all right? And the main varieties would be something called lactobacillus species, of which the most famous one is Lactobacillus acidophilus. Okay, you probably have heard of acidophilus before. And then there's another common series called Bifidobacterium, all right? And then to couple that with what are called spore-forming probiotics, also known as soil-based probiotics. These are bacteria that come from the soil that go into a spore form that protects them to get through the stomach down into the intestines. And in a spore form, they don't even need to be refrigerated, okay? Now, what the spore-forming probiotics do, what science tends to tell us, is that they probably do a good job of promoting the normal good bacteria that live in our intestines, plus those other human-based probiotics you're taking, to actually gain a foothold and establish themselves. There's limited science saying that spore formers actually establish themselves in the intestines, okay, but they support. And so the strongest ways I found to help support good bacteria in the intestines was to take a human variety along with these soil-based probiotics. The human variety I like to use was something called HMF Forte by a company called Ceroil. And the spore-forming probiotic I like to use was something by Research Nutritionals called Corbiotic. Okay, all right. Now, let me just do a quick screen share because I have an article just about the what do I think about probiotics? Okay. All right. So let's see here. Let's just do it up here. Yeah. All right. So this is my article about probiotics in a Lyme germ treatment, and I even talk about how they work. And I talk about how do you dose them. And even in this article, I give you the names, the Corbiotic, as well as the HMF Forte here too. Okay. Oh, one other thing. So I've mentioned some supplements tonight, and many of you may be aware, but if you're looking at a place that you can get good quality versions of those, feel free to take a look at my store, Marty Ross MD Supplements. Realize that when you purchase from here that you're supporting the work that I do here in the webinars and keeping the Treat Lyme site going as well too. The other thing, the advantages of purchasing here is I'm covering the state sales taxes for you. And also we have free shipping available if your order is over $50. In terms of pricing that I offer here, I'm selling at the lowest price allowed by the manufacturers. But what I try to do is at least lower the prices as best I can by covering the taxes and your shipping costs as well too. All right? All right. All right. Thanks for that question, Ann. Hello, Kelly. Hi, Dr. Ross. Thank you, as always, for your advice. You're welcome. I'm wondering what you think of monolaurin. Do you recommend it? It's used for something specific in Lyme disease, such as a co-infection, or is it just an overall good supplement? How often and at what dose would you recommend taking it? Is there any specific brand you prefer? Okay. And many, many thanks as always. You're welcome. So the brand that I recommend, I carry at my store, is a brand called Ecologic Formulas. And I carry a 300 milligram strength there. Okay. So I like monolaurin in my Seattle practice. I liked using as an option to treat chronic virus infections. That was the main reason I would use it. My preferred treatment was actually using another herbal medicine called olive leaf extract. But if I had people that were sensitive to it, then I might switch over to monolaurin. And monolaurin has good antiviral properties based on its functional research, laboratory experiments on its function. Okay. Dosing that can be useful is anywhere from 300 even up to 900 milligrams 3 times a day. If a person is going to use it to treat viruses, because treating viruses sometimes can lead to Herx reactions, I would usually have them start at 300 milligrams, 1 pill 3 times a day. After a few days, if no major Herx, then go up to 2 pills 3 times a day. And in another couple of days, I go up to 3 pills 3 times a day. Okay. I have not found it helpful for other purposes in a Lyme disease treatment. And so I would mainly use it just for its antiviral properties if somebody had chronic active viruses. Okay. All right. Now, how do you know if you have chronic active viruses? Well, I'm not going to go into all that now, but I'm going to just show you a quick article about that. All right. So take a look back at the Treat Lyme site. In terms of viruses, how and when to decide to treat, take a look at this chapter on how to diagnose. And I have a whole article about when and how to treat chronic viruses in Lyme. Okay? All right, right there. All right. Thanks for the question, Kelly. Hello, David. Let's see. I have been put a 3-9 rotation for antibiotics. Every 3 months, I take 3 antibiotics, and then my doctor rotates me to the next 3 on the list, and then to the next 3, and after 9 months, we start over. I have chronic Lyme disease, so we discovered that when I tried to take a break, the numbers climbed again. I also take several supplements. Has this been any progress on how the CDC is classifying chronic Lyme and recommendations for treatments? Oh boy, I'm chuckling because the answer is no. So, the CDC has aligned itself with the opinion of the Infectious Disease Society of America. And the IDSA, as they're called, has a set of treatment guidelines, I think, that were last published in 2006. And they have been in a process of re-updating those guidelines. And unfortunately, they have now recently released their proposed guidelines. And it's more of the same. They tend to, first of all, they don't even acknowledge that Bartonella is part of Lyme disease. They do not acknowledge that persister Lyme that lives on even after antibiotics exist. There's a whole bunch of stuff. It's just, they have had no real changes in their opinion over all these years. All right. If you want to see that, what I would do is just Google IDSA proposed Lyme guidelines. I am sure you'll be brought to their page. Another way you can find it, if those of you are wondering where you can find it, let me just do a quick screen share here for you, because I have linked to it in one of my articles on my website. Let's see here. So what the IDSA is doing right now is they're in a public comment period on the proposed guidelines. And I think this just got put up online about a couple weeks ago, if I'm right. So if you want to see the proposed IDSA guidelines, come to my treatment protocol page, okay? And come down here in the area where I describe what it's about. Take a look, just click on this link here, and that will bring you to their draft guidelines page. Okay? All right. All right. Thanks for that question, David. Hello, Deborah. Let's see. Thankfully, my family doctor is treating me for Lyme. I'm currently taking doxy, zithromax, nystatin, plaquenil 2 times a day, Malarone, 2 tabs once a day, on 4 days, off 3. This seems like a lot of meds. Just wondered if it might be too much. I got a tick bite 30 years ago and was diagnosed with lupus 6 years ago. So the antibiotics, so I can make some comments here, okay, but I can't say whether it's too much or not because I don't know your specific situation. In treating chronic Lyme and co-infections, I have had people on this many things before, and sometimes it is what's needed, okay? In terms of your mix of things, that monolaurin suggests to me that you're also being treated for a infection called Babesia. I don't know if that's true or not. The combinations of doxy, zithromax, and monolaurin would be an effective Babesia treatment. The doxycycline, zithromax are very useful at treating Lyme that lives inside of cells and outside of cells. The only concern I have about your regimen is I'm not clear that there's good enough coverage here for another form of the Lyme germ, which is called the cyst form of the Lyme germ. Some of my colleagues have used Plaquenil, which is a quinine medicine used to treat malaria and Babesia, to treat cyst Lyme, but there is competing science that suggests that it may not be the best cyst Lyme agent as well too, okay? My preference on this type of a regimen to treat cyst Lyme would be to add something called grapefruit seed extract, 250 milligrams twice a day, but you should talk to your healthcare provider about that, okay? All right? All right. So do Lyme regimens involve this many things? Yeah, they do. Unfortunately, it's a very complex illness to get over, okay? All right. Good luck to you, Deborah. Hello, William. Let's see. Have you seen atrial fibrillation from either Lyme or mold? Is it possible to cure of the AFib without surgery or AFib medications? So I have not seen mold cause atrial fibrillation. Atrial fibrillation is a heart rhythm problem, everyone. Lyme, it is possible that Lyme can trigger a number of heart conduction and beating problems, and it's possible atrial fibrillation could be part of that. Therefore, in theory, it's possible that getting Lyme under control may control the atrial fibrillation, okay? The difficulty is, though, is until Lyme is under control, atrial fibrillation needs to be controlled. And so in situations like this with my own patients, I would recommend that they take the medications that are needed to control it, okay? All right. Thanks for the question, William. Good luck to you. All right, everyone. That's it for me for tonight. I've got to go get some dinner. I'm getting hungry. It's about 7:30 here in Austin. As many of you know, I try to have this webinar at this time to reach people both on the West Coast and people on the East Coast, all right? But it's getting to be dinner time for me. So I'm going to go. Thank you for being here tonight. Keep an eye out in your email tomorrow morning for information with links to the recording for the webinar tonight. And also you'll be able to sign up for the webinar in 2 weeks then. Okay? All right. Take care, everyone. Good night.